Good afternoon, everybody, and welcome to the Introduction to Medicine webinar at St George's, University of London. My name is Lanisha. I'm the Events Officer at St George's, and I'm going to be the host for the event today. So the format of this event will be very simple for you guys today. We're going to have an interesting course talk from Hannah, one of the academics on the course, and then followed by a student panel. So we have a panel of 4 current students that are going to talk to you about experience on the course. And then at the end, we'll have a live Q&A. So what you can do from now until the end of the event is send in any questions that you have. So any questions that you have, if you use your questions or chat box, you can send them in. We have staff and students available to respond to your questions. So whether it's about the course, the admissions procedure, student support or finance, or a question for a current student, if you send those in, we will have those answered to you by the end of the event. So before I hand over to Hannah, who will do a course overview for you, I just wanted to let you know that for this event, we can't hear or see you. So the only way you can communicate is through the chat box. So if you do have any issues, maybe you can't hear something or you can't see someone, also send those in and we'll try and rectify those issues throughout the event. If for any reason you get disconnected and cut off, then please do try and log back in. We will still be here up until 5 o'clock. This event will also be recorded. So if for any reason you're unable to stay for the duration, once this event has passed, so probably before the end of the week, we will upload this recording to our website so that you can see everything else that was said. Finally, before I hand over, I just wanted to say that at the end of this event, there will be an automatic pop-up of a survey, and I'd be very grateful if you would take a few minutes out to complete the survey, just so we can have some feedback about the event, so we know what we might need to change going forward. So thank you all for listening to my introduction, and now I'll hand over to Hannah for the course overview.
Hi everybody, my name's Hannah Cock. I'm the course director for medicine here at George's, and I'm also a consultant neurologist in the trust next door. And I'm going to give you an overview of our programme. I'll just start sharing the screen. Okay, hopefully that can be seen. Can you just confirm you can see that, somebody?
We can see that clearly.
Perfect. Thank you. Great. So I'm going to give you an overview of the course, the highlights of the course. Most of this information is on the website, but we're just going to try and convey some of the important things and give it a slightly more human flavour, I hope, from reading it on a website. So sorry, my mouse is not working. There we are. We at George's pride ourselves on the doctors that we produce from our course. So the whole course is designed to turn you, students with aptitude, into confident, resilient doctors who are ready to do the job that we're training you for, ready to work with colleagues and provide a service to patients and the broader population. And we're aiming for everyone to be able to provide excellent, compassionate care and to be equipped for lifelong learning, to adapt to rapidly changing science and rapid changes in society. And that starts right from the beginning in terms of our approach to recruitment. We really have a focus on values-based recruitment. So a lot of that is tested out in the MMI process because we want to make sure that students who choose to come to George's come to us because they share our values, that they want to provide this service and support patients in the future. And as part of that, throughout the programme, we have a lot of interdisciplinary training. You will be learning with UK's only specialist health university, so you will be learning alongside every other student of other healthcare professions, nursing right through to paramedics and physios and everything. Another key feature at George's is that we have learning development embedded throughout the curriculum. So becoming a doctor is not just about learning the science and learning the communication skills and the clinical practical skills. It's about learning how to become a lifelong learner. And that is embedded throughout the course. So just for anyone who hasn't made themselves familiar, this is a talk aimed at the 5-year programme. So we have 2 streams into medicine. We have a 4-year graduate entry only programme, and we have the standard 5-year programme. Both of those programs do start with the clinical science year or years. So for this course, we're talking about 2 years of clinical sciences, followed by a transitional year, and then the last 2 years are clinical practice. But it's important to say that from year 1, our curriculum is patient-centred, and there is clinical contact right from the outset with clinical and community placements. It's quite a flexible course for those of you who do want to, might have a more academic bent. I'll say a bit later on about opportunities to intercalate for students who want to do that, to take a year out to do a different degree. In the initial parts of the programme, where the 5-year stream and the 4-year stream are separated before they all come together for the last 3 years of the course, in that clinical sciences block, we're looking at really equipping you with the professional knowledge, the basic and clinical sciences, and information about patients, population, society. I'll say a bit more about each of those. So the professional knowledge, the professional skills, the clinical and communication skills, and also importantly, the professional values and behaviour that makes somebody into a doctor. And the way we do that is that these core themes, the skills, sciences, and the patients, populations, and society are split up into modules which run over the first clinical sciences block of the programme. So these modules correspond to different disease and body areas. So life control, for example, is to do with the brain and the mind and the nervous system. Life support to do with cardiac and respiratory function, and so on. So it's blocked into those modules which run over the first 2 years. Now we're just launching a brand new curriculum for years 1 and 2 of the 5-year programme, which will be delivered for the first time for the students who are about to start in 2021. So we've done an extensive piece of work which started a few years ago. This is separate from COVID, looking at that part of the curriculum to really update it and make it sort of a more modern patient-centered approach. So the main changes, we still have the life modules that we've always had, but the main changes are that the curriculum is much more integrated. So the anatomy and the physiology and the disease and the patient are much more joined up. There's a lot more case-based learning. We've also built in synoptic weeks at the end of each module. So weeks where the student has time to really consolidate and reflect together the content that's been delivered previous weeks. We've now got a brand new genomics module. We had a lot of genomics teaching, but we've now put it all together because it's become such an important part of modern medicine. And we've also introduced some content about public health earlier in the curriculum than we used to. The patient contact is still there. So in those first 2 years, there are 3 2-week early years clinical experience blocks. There are regular GP visits and also some community visits and diversity sessions scattered throughout the whole of that first 2 years. So that curriculum will have started with incoming students and will be into its second year by the time any of you guys join us. So in those 2 years, let's say the basic and clinical sciences, this is what we're covering. It's the factual knowledge, the anatomy, the physiology, looking at the structure, function and development of the normal human systems at all levels, right from the molecular up to the whole individual, and then building on that to look at the changes that occur as a result of disease, injury or development, and starting to understand the factors which affect outcome and their treatment. Alongside that, in each module, there is a whole strand looking at patients, population and society. So by that, we mean the psychological, social, family, cultural context of the patient, building in epidemiology, research, how to interpret research studies, and also starting to embed aspects of working as part of a team, understanding quality and service improvement and leadership development, because all doctors have a leadership role in health services one way or another. We will also in that stream include information about the sort of legal framework and the ethics and medical law and statistics and regulatory, so that you understand the content for when you get out onto clinical placement. The professional skills are the things that most people think of with doctors, is learning how to listen to a heart, tap a tendon reflex, listen to a chest, those clinical skills, and also doing procedures, taking bloods, putting in cannula, doing more complex procedures. Communication skills are very, very important and something that we put a lot of emphasis on at George's, because if you can't communicate well with your patients and with other members of the team, then doesn't matter how good everything else is, you're going to struggle. And then we have this third strand, this becoming a doctor. So what is it that turns you from a student or an academic into someone who's a doctor? And it's about not only understanding your professional duties and perspectives and having that sort of knowledge and understanding about reflective practice, learning what sort of learner you are, but also demonstrating it in your behaviour. So throughout the curriculum, we build that so that by the time you get to final year and graduate, you are that person who is ready to be a doctor and take that responsibility and work in clinical practice. So how do we do all of this? How do students learn? Well, as I'm sure with any other course, we have a very mixed platform. So this is something that's very different from school streams and from many other university courses. There's an awful lot of different ways of learning, and you will experience all of these. So of course we have traditional lectures, seminars and tutorials, webinars, things like this, but also some very practical hands-on sessions. So things like the clinical skills, the procedural skills, the communication skills, they're taught in a small group, hands-on environment, lots of role play, lots of doing it on mannequins, on simulated patients before you get out into real patients. We do a lot of case-based learning and problem-based learning in the transitional year, including on this 5-year program, to really try and start you putting that information together and using it in practice. We have a lot of interactive and practical anatomy teaching now. At the moment, our dissection facilities are undergoing some essential renovations, but we are expecting them to reopen in 2022. But in the meantime, the anatomy team are doing a fantastic job with some other live interactive 3D resources. And as I mentioned, there are placements and GP and community visits from the beginning. There are also several opportunities throughout the course, including in the first and second year, to do student selected components, to do a piece of work on something that interests you. And that can take a range of formats, including some really interesting humanities projects. So understanding medicine in art or medicine in literature, and some of the more ethical and philosophical aspects of medicine. Now, St George's was already using a lot of technology in its curriculum and its learning environment before COVID came along. So we have a virtual learning environment, we have a video platform on which all of our lectures and seminars are anyway recorded and available. We also had virtual patients, so to support problem-based learning in the transitional year, the third year of the programme, where students have a virtual case and as a group can work through different aspects of how to manage that case. The university has a lot of these MOOCs, massive open online courses, which are available to anyone internationally and nationally. Well, quite a few of those are embedded in our curriculum on clinical communication, on organ donation later in the course. So we had a lot of stuff going on anyway, and promoting interactivity in lectures and tutorials and using the online environment. So we were well placed to then adapt that for the clinical sciences years when the pandemic hit. So as a result of the pandemic, we now have a really well-formed and well-articulated online education framework that the whole university has contributed to. And our expectation for the next academic year, and to some extent indefinitely, is that all of our small group teaching and our practical and skills sessions will definitely be back on site. In the longer term, they work better. It's hard to teach those things remotely, but some of our large group lectures and tutorials will stay online because student and staff feedback, there've been extensive surveys on this both internally and nationally, was that it worked better actually, that students liked that flexibility for some of the teaching. The virtual anatomy I've mentioned we're using a lot this year, but the dissection room team have also created a lot of their own resources, and like many of the schools in the country, we've really pulled together to harness some of the available online learning tools and shared resources. And you can read more about the overall approach to our online education framework. So in the long term, we anticipate a blended curriculum, particularly in the early years, where there will be some on site and some online, informed by student feedback about what did and what didn't work during the pandemic. So I'm going to come on now to talk about the clinical practice years. So this is the transitional, and then the penultimate and the final years, we start to get out onto blocks of placements for longer periods of time. And this is the point in the transitional year that our 4-year graduate stream and our 5-year which is mixed school leaver and some graduates, all come together and are all mixed up for the last 3 years of the course. So in the clinical practice years, it's much more of an apprentice style learning once you're out on placement. So you're attached to clinical teams and wards and firms, and you're starting to put into practice the things you've been learning in the previous years in the skills environment, actually out on the wards. And our curriculum then is still framed around knowledge, practicalities and the professionalism side of things. So we have a clinical priority list, which will be mapped to the national medical licensing exam that's coming in, which basically are the conditions that you need to know about and the disorders and the presentations. We have the clinical practice outcomes, which look at those skills and communication skills and integrated learning, the things you need to know how to do and demonstrate that you can do on your placements. And we have this becoming a doctor professionalism, behavior, engagement strand as well. So in the transitional year, there are 3 placements. There's a general practice, a medicine and a surgery placement, alternating with blocks of problem-based learning. So in that transitional year, you're doing a mixture of university-based work and a mixture of clinical placements, which will complement each other, and you rotate through each block. When it comes to the penultimate year, it's essentially all clinical placements. So there are 8 different placements. So we're getting into more specialist areas, so neurology, psychiatry, obs and gynae, pediatrics, more senior medicine and medical specialties, and senior surgery and surgical specialities. And almost all of that is out on clinical placements. There are some weeks, 4 weeks spread through the year, where there's some more didactic content being delivered. And of course, there's a lot of procedures that you now need to be learning how to do on patients and being signed off on placements, so work-based place assessments, to demonstrate that you can pick up these skills throughout the course. When you get into final year, you should, before you start final year, you've basically covered pretty much all the content and the knowledge that you're going to need, except for some critical care and anaesthetics and some emergency and public health. So most of our final year is assistantships, where you're attached to a junior doctor for a 5-week block. So again, one in medicine, one in surgery, one in general practice. And you're really shadowing that doctor or that team and learning how to do the job. So you start acting up for the doctor that you're about to come. So we have 3 5-week assistantships, and also some placements in emergency medicine, critical care, public health, and quite a lot of sim teaching as well. So simulation teaching. There are some procedures which the newly qualified doctor isn't expected to know how to do in patients yet, but is expected to know how to do it in a simulation environment. So we'll cover that in those years. And again, we have some student selected components. So we have 2 blocks in the final year to enable you to do a bit more in an area that interests you. It includes the elective period after the exams, when many pre-pandemic and hopefully again post-pandemic people will often travel abroad and experience medicine in a different part of the world. So there's 2 blocks, 2 5-week blocks in final year to support that. Our placement locations are mostly in and around London and the Surrey borders. In the transitional year, we keep you pretty close to us. We have a small number of partners trusts. In the penultimate year, we start to spread a bit further afield. And then when we get into final year, we have some placements that are really quite a long way away. Now, of course, with the further distant placements, then accommodation is provided. And very often students really love those more distant experiences. And it is a requirement from the GMC that we train doctors with some experience, not only in city-based medicine, in urban tooting, but also in more rural and different community environments. And so a lot of students have a really fantastic experience when they go to some of these other sites in their final year. Now, I can't talk about the course without talking about assessments. No student likes them, but we have to have assessments. We are a regulated program. We have to run exams. We had to run them even in the peak of the COVID pandemic. You know, it was not an option to cancel exams for medical schools because of patient safety, ultimately. So our basic framework for assessment includes assessments of professional knowledge. So this is the factual and interpreting information which is mainly done by end of year specific knowledge tests, which are mostly single best answer questions, a type of multiple choice. So there's a scenario and then you select the best answer. There are some short answer questions in the early years as well. In each of the years, except for the first year of the programme for 5-year students, there's an assessment of your skills. So this is an objective, structured clinical examinations, little scenarios that you rotate round and demonstrate that you can take in history and elicit it or communicate something or perform an examination. And then we also have this becoming a doctor assessment strand, and that's really a measure of attendance, engagement, your professional behaviour, showing that you know you can organise your time, that you're taking charge of your own learning, and that we build that up. So you're not expected to hit the ground running with that, of course, but that's something we will help you develop over the course of the programme. And in order to progress each year, you do need to pass all 3 of those domains. You can't compensate across them. And by the time you guys graduate, any of you who apply to get into any medical school in the country, there will be this national medical licensing exam coming in, which we have been working with the Medical Schools Council and the GMC. We've been part of the pilots. We're very comfortable with that. And that will take over from our current final exams. It's essentially the same format, and it will be instead of our current finals. So I mentioned earlier the opportunity to intercalate. So I know many universities, you have to intercalate or you can't. It's sort of one or the other. We have some flexibility in that. So you can choose to intercalate. It is competitive at the moment. We can't allow everyone to do it because for lots of reasons. But there are opportunities at multiple points in the course. So some students will do it before they start their first clinical practice year, before transitional. Some people will do it between transition and penultimate, and some people will do it much later on in the course. Between the penultimate and the final year, for students who've already got a degree or who've done well in their transitional exams, because that's the same as a standard degree level, then there's also an opportunity to do a master's with some programs, and that really gives you an excellent opportunity to test out whether you might be interested in a research career or medical ethics or teaching or a particular area of medicine that interests you, and just to spend some time studying and learning in a different environment. And it's a really valuable experience for students who choose to do that. I don't know anyone who regrets doing an intercalated degree. COVID obviously is very much still in the news at the moment, and we hope will become less of an issue over time. But as a specialist healthcare university with on-site health professionals in the trust next door, we were well placed to really respond quickly to that, and very quickly had a process set up to keep our staff and our students and of course patients safe. And I've summarised some of the changes that happened as a result of the pandemic here. Last year, our early years and critical care placements were replaced by remote experiences, but every other placement was back on site. And for the 2021 academic year onwards, we're expecting all of our placements, including the early years, to be back hands-on in the community and on placement, and for staff and students to be safe in doing that. So why at the end of all this should you be choosing George's? Well, as I said, we're a small university. We like to think we're small, but beautifully formed. We are very much all about healthcare and our local population and serving the community. You know, we're one of the few universities that's physically located within the community that we serve, which is a real bonus. We're co-located with a large teaching hospital, which means that a lot of clinically active, I still do clinics in the trust, I still do ward rounds, I do all of that, and I can only do that and be course director because we're on the same site. It enables that, and that's true for an awful lot of our clinical academic teaching team. We're a modern adaptive course. We're using a very wide range of teaching methods and technology, and you will be taught by academics and clinicians who are really passionate about medical education and passionate about providing the best patient care and training doctors who will do that. So you will also study and live in a vibrant, diverse area of London. I live locally to George's. I absolutely love it there. I've never regretted moving there. And as a university, we're ranked first for graduate prospects. So it's a really positive place to come and learn to be the doctor that you want to be. So thank you very much for your attention. That's my name and title there. And thanks also to Laura Byrne, who's one of our admissions tutors and also a consultant in the trust next door. That's all I was going to say, but I will go on to the chat now and help with answering questions as well. Thank you for your attention.
Thank you very much for that, Hannah. I hope you guys all enjoyed that. There's a lot of useful information there. So we will have our current student panel starting in about the next 5 minutes. But just before we do that, I'm going to show you guys a video. And this is a video that will show you what our campus is like. Since we're not able to offer this event in person, I just wanted to give you guys a little bit of insight into what St. George's looks like and the type of facilities that we have. So if you just bear with me a few seconds, the video will start in a few moments. I hope you can all see this. I'd be very grateful if you can see the video which I've just paused. Can you just type that into the chat box just so I know? Because I've seen somebody has written that they can't see the video. So if you can see the video, quickly please just type a yes. Oh, excellent. Thank you very much, Sadia. I'll continue to play it.
can't wait to meet you and show you around in person.
I hope you guys enjoyed that brief tour of St. George's. Okay, so now we're going to have a live student panel for you. So if I could ask our current students to turn on their cameras and come on screen. Awesome, thank you. So these are our current students, and they're each going to spend about 3 minutes just introducing themselves and talking to you a bit about St. George's from their own perspectives. So I'm going to hand over to Misha to start us off. I hope you guys enjoy.
Hi guys, I'm Misha. I'm in my penultimate year of medicine. I've just finished intercalating, which is doing an extra degree in the middle of your medicine degree. And I did that in psychology, psychiatry, and clinical neuroscience. So technically, I'm in my 5th year of medicine, but on my 4th year of the actual medical course. I grew up near Heathrow Airport, so I've always been in London, and I absolutely love how busy it is here. So that was one of the reasons I chose to study at George's. It's so well connected to central London, but we get the outside of London prices. And also, one of the best things about George's, which I noticed, is I actually was lucky enough to do my work experience there. And when I was on the placements, I was in year 12, I felt included. And you often feel like if you're a student on the ward, especially one that can't do anything, that you'll get excluded by the staff or you won't sort of learn anything. But it actually felt like they were actively including me, trying to teach, and I felt like I fit in already, which is just such a good representation of St. George's environment. It's so welcoming and friendly. If I had to pick one moment just highlight, it would probably be a moment from placement. So it was 2 years ago at Christmas. I was on placement at a gastroenterology ward. So it's all about your stomach, your liver, your intestines. And we were just doing a regular clinic, and a lady came in for an appointment, gave a present to her main doctor because she didn't know a student was going to be there. And then she left and she said, I'll be back in a bit. And she actually came back with a present for me and a little handwritten note. And she was like, from this experience, I know you're going to be an amazing doctor. I wish you all the best. And it's those kind of heartwarming moments that give you that motivation to keep going, because medicine is long, it's hard. I'm not going to lie. There are points where you go, can I do this? And things like that make you go, I can, I know I can be that doctor. So St. George's gives you all of these experiences to prove to yourself as well as to others how good you'll be as a doctor. In terms of sort of challenging aspects of medicine, the biggest challenge for myself personally was learning how to learn. That sounds a bit bizarre, but you've gone from being sort of spoon-fed information at A levels to being thrown a bit in the deep end with having to know all of this information. So learning how to learn effectively for yourself takes a bit of practice. I have gone through flashcards, and then I'll go to handwriting on my lectures, and then I'm back to flashcards, and then I'm only listening to lectures. So it's just finding that way. And it takes a bit of time and a bit of practice, but at the end of it, you end up learning all of this information, and George's is there to support you along the way. But that is all from me for now, and I will hand over to Alina.
I hope you can all hear me, just let you know if you can't. My name's Alina. I've just finished my final year at St. George's. Can't believe it's all over, and I'm looking forward to starting my first doctor job in about 3 weeks actually, up north in the East Midlands. So I come from the East Midlands, so it's quite nice to go back home. The reason why I chose St. George's way back, about 6-7 years ago now, why it was one of my choices is it was a healthcare-based university. So it was very, very specialised. All the subjects that were taught were all, you know, complementary specialties. We also have affiliations with, I think, Kingston University, who teach nursing, pharmacy, and we ourselves, we teach biomedical science students. We've got new courses as well, always popping up. So it's really nice to sort of learn with students who will be your colleagues very, very soon in the future, and just to see what they do. It's also a really well-established medical course. I believe it's the third oldest medical course in the whole of the UK. So we have lots and lots of experience with teaching medical students, keeping up to date with research, keeping up to date with new opportunities and new sort of teaching methods. So it's really well-established. So I actually really got into medicine when I was sort of 15, really enjoyed watching 24 Hours in A&E, really enjoyed watching Casualty, really liked sort of the high dynamics of it. And one swaying point as well is that we are attached to a hospital. So we've got the St George's NHS Trust literally next door. So just open a door and you're in the hospital, which is a major trauma centre. So it's always really busy. There's always a lot going on, and there's always opportunities to do something over and above what you do in medical school day to day anyway. So I got a lot of opportunities throughout throughout the 6-7 years that I've spent here, sort of doing more projects and building new connections, and St George's offered me all of that in such a short space of time. So the most challenging part I found was actually not the curriculum itself, but it was moving to London, because I'm not from here, I'm from sort of Leicester area, and it was moving to London, budgeting wise, moving away from family for the first time, sort of, am I going to make new friends? What social things are they available? So I didn't know any of this. But one thing that actually really helped me to settle down was the new activities that they offered in the first 2 years. You might have heard of it as freshers, freshers sort of 2 weeks, but it's a really good opportunity to meet new people, to make friends, and to really help you sort of get settled down in the first 2 weeks. And they also offer like a lot of events. At the moment, COVID, it's difficult to meet face-to-face, but there's also a lot of social events going on, sort of online social circles, etc. So you really won't be alone, and there's always a lot of people available to help you. I was also really surprised actually when I came to St George's. I went to the open day at the beginning, but a lot of information went sort of in through one ear and out through the other. But I was surprised at sort of how welcoming people are. And if you do get a chance to come and visit St George's, whether in your interview or offer day, please do take that chance. I'm going to now pass over to Munira, if that's all right.
Hello everyone, my name is Munira and I'm a second-year medical student. I originally live in East London, and so I commute to George's, which I find quite manageable. The reason why I chose St George's is because I did my biomedical sciences degree here, and it was through that time where I saw, you know, several of my friends who are actually studying medicine, and I saw how fantastic the course was and how much they really enjoyed it. And in time, when I had decided that I wanted to study medicine, something that really stood out to me about the course at St George's was that they offer clinical experience from the very first year. So because of COVID, we haven't had too much, but we did get the opportunity to visit patients in their home as part of our GP visits. And this is something that was, I think, really amazing, because it allows you to develop as a medical student, because you get the opportunity to develop your communication skills and your history taking skills. And not only that, but I think it gives you an idea of what patients are living like. You know, these are humans who have homes and they have their own lives and families. And it really gives you a sense of appreciation for the daily challenges that they might be facing and how they overcome that. And then I think that's a really humbling experience, knowing that one day, you know, as future doctors, I would be helping these people. I think something that really surprised me when I came to St George's was I always knew that it's a specialist institution, that it's quite small, but how tight-knit it really is and all of the support that's available. So because it is a small university, it means that often you share lectures with people from other courses. So within the medicine course, you will have lectures with the biomedical sciences cohort and the physiotherapist. And it means that when it comes to doing revision, you often get shared revision sessions and everyone is always willing to help each other out. And I think especially as in your A-levels, you are kind of spoon-fed coming to university does seem like a big jump, but because you have all of this support around you, it is really a fantastic environment to be in. And not only that, if you ever have any personal issues or, you know, things just get a bit too much, you can always go and speak to your personal tutor. So that's someone you're going to be assigned in your first year, and you can go to them for any concerns or anything you really want to talk about. If you ever have any issues with any of the lectures or any of the teaching, you can always email the academics. And this is something that I found really helpful, because it meant that I could clearly learn everything that I needed to and solidify that knowledge. And finally, if there are, you know, more pressing issues, there is a confidential counselling service here, which is really beneficial and available for anyone to access. So I'll now hand over to my colleague, Sophia.
Thank you, Munira. Hi, everyone. I'm Sophia. I'm also a final year medical student at St George's on the MBBS5 course. So it is crazy that now, after 5 years at St George's, finally embarking on what I've been trained to do, to be a doctor, which is really exciting. So I've always lived in North London, and I've always commuted down to St George's, which has been a really easy commute, just straight down the Northern Line. And in this way, I've actually made a lot of friends, because a lot of my group are all from commuting around London. So I thought that was going to be a challenge coming to St George's without staying in the accommodation provided, but it actually proved to be a way to make friends in first year as well. So originally I chose St George's, and this has proved true over the 5 years, because it's really small and close-knit with a really nice community feeling. The diversity is something that we all appreciate and we love about St George's. All the different societies that are offered there. And being based in a hospital as well creates the environment which kind of marries up our studies with our professionalism, and it keeps us exposed to what we're going to be seeing as professionals from day one, literally the first day that you walk in, even for your interview. So some challenges about being at medical school are balancing studying for exams when it comes to exam season, as well as attending placement full time. So you might be on a GP placement attending 9 till 5, and then you have to go home and study for your exams, which are next week. But I think, as well as being a challenge, it's also perfect, because when we're a doctor, we'll always have to balance our professional development and studying alongside our clinical duties as doctors. So although it's a challenge, it's something that is good as well. Now I will hand over to Linisha.
Thank you very much for that, guys. So guys, I hope you enjoyed hearing from our current students. If you have any questions that you would like to ask these guys, please do send them in now, and we will answer those live on air. I'm also going to invite back our course director, Hannah, to join us back on screen. So if you have any questions from an academics course director's perspective as well, send those in now, and we'll get those questions answered live on screen. So I'll just wait a moment for your questions to come in. While we're waiting, why don't, I'll just throw it out to you students, why don't you tell us one thing that would have been very helpful to know about either St George's or the course prior to studying that you know now that you have started? That makes sense. And anybody can answer. Maybe it's something that you wish you might have had before you started, whether it was a stethoscope, a Dell laptop, or I don't know what it is.
I think I've got something, and I think it will apply not only to St George's but to medical school in general. So before you start medical school, you can imagine there's a lot of learning that's going to happen on day one, and people might recommend books to you, they might recommend resources to read, they might recommend a bit of pre-reading. Do not buy the books, because St George's has such a big library where they're all available, and they also offer online copies of the books as well, which you can log into on day one. So conserve your money, spend it to something else, because we have a lot of learning resources available.
Okay. I have a question here which you might not be able to give an exact answer for, but maybe you can give the audience a bit of an overview. Somebody asks, what is the percentage of males to females amongst the medical students. So what is it like for you guys in your cohorts?
I feel like it's pretty 50-50. I mean, we get split into groups in our like clinical skills sessions, our communication skills, and I feel like the university makes an active effort to do a split of genders so that you can not only perform clinical examinations on each other on different bodies, because obviously if you're doing an examination on a female, there are more things to take into consideration sometimes, but it's also important to get that sort of different viewpoint and help each other sort of learn together. So I feel like it's quite 50-50. I'm not sure if that's actually the statistics, but that's how it feels.
Yeah, I think I don't have this year's exact numbers, but I mean, most schools in the country, there's slightly more women than men getting into medical school, but it's really marginal. It's you know, a tiny percentage more, and it differs a little bit with 5-year versus graduate entry. I think it shifts a bit more evenly into in the more mature, in the sort of students who've done a first degree, but it's pretty close to 50-50, if not exactly. And you're right, we do deliberately try and mix people up in all sorts of ways. We want to embrace all aspects of our society and all cultures and all backgrounds. And again, that's something we want to train doctors who will do that. So we try and take that approach from the beginning.
Okay, thank you. Thank you for that. So somebody has asked, what did you find was the worst part of the course? Maybe the worst part might not be right. Maybe what did you find the hardest with the course? Might be a better way to phrase that.
I'm guessing that's not to me, that question.
Yeah, I think this is for the students. Yeah. Whoever would like, anyone, any of you could answer if there's something that comes to mind. I mean, I know when I see emails coming from inquirers, one thing that seems to worry people a lot is PBL. So maybe you can tell us what PBL was like for you guys.
Sure. So in PBL, I had PBL in T-year, and that was in person before the pandemic, and it was really nice because every week we would meet with a group and our tutor who would just guide us along. We would have a case to dissect basically and go through the case, and it would create questions in our minds and make us really curious about what's going on and what's happening, and we would have to kind of work together and bring in different opinions and skills and things we'd all researched online. So it was quite challenging, and it felt sometimes annoying, like, why don't I know the answer already? But then that stimulated us to learn and go home and research and listen to what each other had researched in our own time. So I quite liked it in the end.
Is there anything else, any Misha or Alina, Munira, anything that you guys found particularly difficult?
You can speak freely, I won't hold it against.
I think part of medicine that you kind of know is going to happen is the emotional aspect. So, for example, I had a patient who did unfortunately pass away after my shift because I made him promise not to when I was there, because we had quite a nice little relationship going, but it does affect you, and you just need to be able to deal with that in the appropriate manner. So Munira was talking about the counselling that the university has. We have debriefs with all of the staff, but I found that's probably the hardest part, just sort of learning how to emotionally cope with what happens and what you see, because it's not a regular degree. Regular people don't see these things on a day-to-day basis.
And just with that, actually, I personally found when I first started placement, talking to patients really difficult. I didn't know what to say. I didn't know how to make my language patient friendly. And I just sort of stuttered. The conversation got stilted, and it was pretty tough for the first couple of weeks. What I would say is like the comm skills sessions, communication skills sessions you will receive from probably sort of week 1, week 2, going all the way through your medical course are so essential, and they are vital skills. Even though you may think sort of empathy skills, they're just, you know, common sense. It is really important, you know, to practice, and I think St George's does that right. It gets us to practice on a regular basis, and when it comes to your placement years, it will make everything a lot easier.
Okay, thank you for that. I had another question from somebody about personal statements. I'm going to reword it so that you're able to actually respond. But well, their question was, how were your personal statements? Were they all fancy and things like that? I guess for you guys, what was your focus when writing a personal statement for medicine? What was it important for you each? What did you each think was important to include? You don't have to go into too much detail, just a little overview. I'll start with you, Misha.
Whatever you say, give evidence. That's the #1 thing. If you're saying you're a good team player, great. I could say I'm amazing at football, but where's the proof? You just need to always give evidence for what you're saying. So think of it a bit like an English essay where you have to do that peel structure. Make your point, give your evidence, and how is that actually relevant to medicine? And that gets you through a lot of those sort of key characteristics of a doctor and shows them that you are ready and you know you have those skills.
I just want to add to that really quickly because my point's quite similar. One of the key skills of a doctor, and it comes up on appraisal every year, is the ability to self-reflect, the ability to see what you've done in the past and how you can either change that situation, how you felt in that situation, how you could have done better. So that's a key skill that you need to show in your personal statement and in your interviews when it comes to that as well. So the experiences that you have had, work experience, volunteering experience, any experience, you need to be able to reflect upon that and show, like Nisha said, how that enables you, to become a good doctor.
Anything else, Sophia or Munira, you'd like to add to that?
What I found helpful with self-reflecting on my experiences is actually writing down all my experiences that I thought might be relevant and kind of seeing how they gave me skills to be a doctor, and then trying to write my personal statement from there and trying to make it in a good structure that makes sense to the reader, with a nice introduction, body and conclusion, I think.
Perhaps if you don't mind, I'll just add to students, it's always fantastic to see you guys progress and go through the course, especially those of you who are about to start work, the real world. A lot of what you've just said is exactly, I can see there are questions coming up about the MMIs and preparing for interview, and actually it's the same stuff. I'm sure you'd echo that, in the interviews, what we're looking for is students who know themselves, who know what their own strengths and weaknesses are, who know what it is to be a doctor, to be a healthcare professional, why that's different from other from other degrees, and what it is about you, and evidencing that. So how you know that you've got good communication skills, or good or problem solving, or team playing, and it's the same stuff that we're looking in interviews. And really the reason we don't look at the personal statements, really we look at the MMI scores are very important for us. If you meet the criteria, you're invited for interview, is because we get to see really you, not whoever else helped write the personal statement. We get to see you demonstrate those skills and show us that you've got those aptitudes, and the beginnings of the potential to be a really reflective practitioner, as I think it was Alina was talking about, learning about yourself and learning from others.
Excellent, thank you for that, Hannah. Another question that we just had was, do you get much free time as a medical student? I'll open that to any of you guys, whoever wants to jump in.
Sorry, go first, Munira.
Sure, thank you. So since I'm in my second year, I do find that I have quite a substantial amount of free time. So it means that I'm able to undertake a part-time job, as well as working as a student ambassador. It allows me to fulfill my other hobbies. I think it's just about managing your time effectively. If you get things done early on, it gives you the opportunity to have time to do other things as well.
Yeah, I was going to say pretty much the exact same as Munira. As you move through the course, you do get slightly less time, but that is just because you're covering more content, you have more placements. You have to take into consideration you might be living somewhere else. You might have to commute an hour and a half somewhere, do a long surgery day. My longest was 12 hours, I think. That was a very, very long day. And then you have to commute home again. So your time does get less, but it's all about managing. Don't get sort of left behind on lectures. I did that quite a lot during first year. I'll come to it later. And then suddenly you're 2-3 weeks behind. So avoid doing things like that. And I saw there was a question about sort of money. As Manira said, you can get part-time jobs. I still have a part-time job going into my penultimate year of medicine. As well as being a student ambassador, I do some sort of waitressing things. I work as a tutor. So you are able to work as long as you organize your time and don't sort of over distribute yourself or like share out too much of yourself and wear yourself thin. You need to make sure there's time for leisure, relaxing, even just doing nothing. Having a little scheduled like 10-15 minutes of I'm just going to sit in my room and not touch my phone, just de-stress. You need to make sure that you're doing those actively, because otherwise you'll go weeks and weeks and weeks and realize you haven't checked in with yourself recently.
Thank you for that.
Really sound advice, Misha. I couldn't have put it better. It is a full-time course, just so people make sure they are aware of that. Yes, there is some flexibility, particularly in the early years, but ultimately it is a full-time course. But it is important to build in that time to protect yourself. And if you choose to do a job or something else around the course, that's of course entirely down to the individual. But it is important not to overstretch yourself, and that goes for the rest of your lives as a doctor. This is a demand role, an emotional, academic. You know, the responsibility and respect that comes with being a doctor is not to be taken lightly.
Thank you all. So that was our last question that we're going to answer live for you all. I can still see there are a few unanswered questions, and we'll try and get those answered in the next few minutes. Any questions that you've sent in that haven't been answered, an email response will be sent out within the next day or two with responses to those remaining questions. A few things that I can answer quickly right now is somebody asked, where will this recording be? We have a webinars page on our website, and that's where people can sign up to webinars, and where also recordings from previous webinars are also uploaded. So keep an eye out on that page if you want to look at this recording later on. Yes, so I will just say thank you. Thank you for taking the time to tune in and listen and watch us live. And as I said, those remaining questions, we'll try and get through them now over the next few minutes before we officially close the event. Thank you so much, Hannah, for your insight into the course. Thank you also, students, for your expert current student insight into the course. And so that's it from us, guys. So we're going to be off camera now, but we will be around for a few more minutes just to respond to those last questions that you've sent in. Thank you all so much. I hope you've enjoyed this event today, and we hopefully look forward to welcoming you to St. George's in the coming months or years. Bye. Thank you all for joining us. The event is finished now. Goodbye.
Thank you.
Thank you. Bye.